Bonjour, je m'appelle Stefan. Pardon, I'm going to speak in English. It's much easier for me, especially with as much technical content as I plan to cover. And I have a lot of content that I plan to cover. But thank you. Thank you for having me. So my name is Stefan, like I said, and I work for the United States government, specifically for the Office of the National Coordinator for Health IT, or ONC for short. And today what I want to do is I want to speak a little bit about three things. First, give you a very quick primer on what our agency does, so you can understand how we sit in the U.S. federal healthcare apparatus. Second is talk a little bit about my work and how I specifically focus on supporting innovation in healthcare technology. And then third, I'm going to talk about Together Health, and specifically the science of innovation ecosystem building, and kind of what we're doing in the United States to try to connect regional innovation ecosystems to each other, similar to perhaps what you might be familiar with this ECH Alliance and what they've done in Europe, the European Connected Health Alliance. And then I'm going to give a quick commercial for the Global Digital Health Partnership, something that we're looking for more and more countries to participate in. So first, ONC, our mission is pretty simple. This is the actual verbiage from our website. I'm highlighting only two sections that I'd like to focus on, which is to support the adoption of health information technology and to promote nationwide health information exchange to improve healthcare. It's a pretty big goal, pretty general. And to know that ONC is the principal federal agency, so the primary agency in charge of coordinating this across all federal government agencies. We lead something called the Federal Technology Coordinating Council, which has 40 federal agencies, and 20 of those are under HHS. The other 20 are things like the U.S. Department of Commerce, the United States Postal Service, agencies that you may not expect to have a role in healthcare, but actually do play a significant role. For example, Postal Service helps us with address specifications data that helps with patient matching. So, as far as our approach and how we do this work, it's very simple. We like to focus on standards, data standards, exchange standards, business standards to support interoperability, certification of electronic health records. Companies like Epic and Cerner have to attest to our criteria, and then focus on facilitating the exchange of that data and to open it up so it can be available at the right place, at the right time, for the right purposes. And we do this in coordination with our federal partners, like I mentioned, on the council, as well as state and public, including private sector entities, in one big coordination effort. And we do all of this really to achieve the two primary objectives of advancing the development and use of health IT capabilities and establish expectations for data sharing. As far as our key focus areas, this is a very simple pie chart here to give you an idea. We try to spend equal efforts in standards and data, policy development, infrastructure, and then focused on actually implementing these things. As far as what's driving us from a legislative perspective, Congress passed the 21st Century Cures Act and went into law and was signed into law under the Obama administration, fully supported through the Trump administration, and also continues to have full bipartisan support in the Biden administration. And it's really focused at putting the patient at the center and in control of their data, being able to mediate the exchange of that data, to give them transparency into cost and outcomes of their care, to look at making sure that they have competitive options for getting medical care, to modernize how we deal with smartphone apps, and to make sure that those apps can compete in the marketplace as well, to give them that convenient access. And then that app economy to make sure it doesn't just support patients, but also physicians. They have the tools that they need, hospitals, payers, and other employers. And I could spend an entire presentation just on the 21st Century Cures Act, but I won't. Hopefully you'll make these slides available. There's a lot of links if you would like to learn more about what's driving our activities currently. But where we started as a federal agency, which was our initial enabling legislation, was known as the HITECH Act. And this came out of the American Recovery and Reinvestment Act when we were trying to get our economy back on track. And it supported a number of industries that were laggards in adopting technology, healthcare being the most significant. And it provided a lot of incentives. You might be familiar with the Meaningful Use Program in the United States. That was launched under the HITECH Act. CMS, the payer in the US, would determine what qualified for meaningful use, and they would pay reimbursements based on that. And we would set the technical criteria to ensure that the right systems could be certified to capture that data. But what a lot of people don't realize is that also gave us some pretty amazing responsibilities that aren't talked about a lot, and I highlight them here. Among all the duties we have, we're also supposed to be ensuring a more effective marketplace and to ensure greater competition in that marketplace. And that drives a lot of the actual portfolio of work that I do, which is focused on supporting innovation. So it's a pretty amazing responsibility when you think about how do we support competition in an efficient marketplace. So one of my roles is to also be looking at, and this is my senior advisor long-term strategy role, is to look at the health IT horizon. So what is coming around the corner? Not what are we currently mandated to do, but what will Congress ask us to do in 5 or 10 or 15 years? And how do we be better prepared to not only answer that call, but potentially even encourage Congress to give us the authorities to address those issues. So rather than waiting for the industry to tell us that we need to do something around responsible use of AI in health IT to mitigate the effects of bias and to mitigate its potential for harm and risk in our healthcare system, we try to work with Congress and try to work with others to make sure that we're looking at that sooner than later, and then eventually as authorities need to be given to us, that we can get those. But really tracking those emerging technology and trends and making sure that if there is a need for greater coordination and work in partnership, that we're doing that. As far as how specifically do we support innovation, we do in 2 ways. Directly, by funding certain activities. We do a lot of challenge prize competitions under the Competes Act and American Innovates Act authority. So we can run accelerators, prize challenges, competitions, open innovation type challenges. And we've got a long history of doing that. There's some examples on the right. But cooperative agreements and grants where we fund pilots to try to spur activity in areas where there's not enough activity currently. And it might be something as simple as an executive order comes out around behavioral mental health and wanting us to do more work there. We might run some kind of a grant pilot opportunity to try to prove out some successes in that area. But we also do a lot of our work through indirect, kind of the soft nudges to the industry. We provide a lot of toolkits and free resources, guides, technical resources. I list some of them there to make it easier for anybody who's building in technology in healthcare to take advantage of open source standards that may exist, testing toolkits that may exist, and learn from and iterate on top of work that's already been done, so not everybody's starting from scratch. And then as a convener and a coordinator, bringing together all the different parties, making sure they're all at the table, working together in concert to look at the commonalities and shared interests that they need to collaborate on. And there's a lot of different ways we do that. We also manage the Health Information Technology Advisory Council. It's an external advisory board to the U.S. federal government around healthcare technology adoption. And that's something else and what I'm going to talk about, the Together Health Collaborative. But before we can figure out how to support these, we really need to understand, just as a doctor needs to understand their patient population, a federal government innovation advisor needs to understand the innovation community. So in coming up with the definition, I bucketed it into 4 key areas. And hopefully all of you will see yourself in one of these 4 areas. If you don't, talk to me and I'll see if I can either adjust this or help you understand how I see you being in one of these areas. But early adopters who are either implementing and testing that emerging technology and approach, and that could be an entrepreneur, or it could be somebody within a large organization who is that one, early adopter and the one who's pushing the envelope constantly. Entrepreneurs and developers who build those technologies and bring them to market. Investors who financially support the builders and implementers of those technologies. And again, that could be venture capitalists, angel investors, or they can be corporate investors, a hospital investor, whoever it might be that's funding that activity. And then this broader bucket of everybody who supports the above 3 categories. And that's incubators, accelerators, boot camps, associations, membership networks, et cetera. And it's important to also know that as you're supporting innovators, that they require different support at different levels in their journey. So on the far left, on the ideation sides in stage 1, this is typically where they need, it's more around exploration and discovery. And the type of support that they need at that phase is significantly different than someone who's trying to scale their market or scale their solution and bring it to market and actually needs that deployment support. So as we build accelerators from the federal government, like the Pandemic X Accelerator, it was more focused on that transition from stage 2 to stage 3. What is the types of curriculum and support, connections, access to capital, et cetera, that's needed after they've already proven and developed something that's been tested, piloted, validated, and how do we now connect them to widespread market penetration? But understanding how we work with different startups at different stages is important because it helps the design of our programs. And then as far as the role that we have, we're just one stakeholder in a broader innovation ecosystem. I wanted to talk a little bit about what do we mean by an innovation ecosystem. There's a paper by the National Science Foundation. Deborah Jackson wrote it maybe 10 years or so ago. It's very easy to read. I encourage you to check it out. But it breaks down the science of an innovation ecosystem and how it's similar to a biological ecosystem, and how the environment, both with the physical environment and the living environment, the abiotic and biotic, how they need to work together in perfect harmony to have the greatest output and to have sustaining life. It's the same thing in an innovation ecosystem. If you want to sustain the cycle of innovation, everybody needs to work in perfect harmony. So in this case, analyzing how we could do this differently in different places also is key, right? A biological ecosystem in the desert operates very differently than one in, in the northern tundra area, right? So understanding where you're at and then customizing your approach and taking advantage of what resources are available to you is critically important. So in that, thinking about your regional ecosystems, and this is not healthcare specific, but figuring out what are those key considerations you need to have to get a good handle on your ecosystem. First is take a look at the assets you have locally. Who are those key stakeholders? Every city, every region has its industries, its companies, people, resources, or other assets that can be tapped in to create that future. This is your roadmap for who to start bringing together. It doesn't always even have to be from the same sector. So if we're looking at advancing an innovation ecosystem for healthcare, there might be industry giants in your region, like Airbus, for instance, in this region, that might have some skin in the game to play and contribute to the growth of that healthcare innovation. So sometimes it's both the traditional stakeholders as well as the non-traditional stakeholders you want to pull together. The second is what makes your city or region unique? What are the specializations you can lean on and that can help differentiate you based on your strengths from other ecosystems? The third is what lies beneath the surface that, if unleashed, could really completely change the trajectory of that ecosystem. So that untapped potential, those untapped resources or uncoordinated resources that if you coordinate them, if you access them, could really change the game. And then lastly is what are the startups, the corporations, all those different stakeholders, how can you get them to find common ground and work together? And it's usually the most challenging task. This comes from a report in the US, this organization called Rise of the Rest. This was out of their 2018 ecosystem playbook, and I think it's a very simplified assessment of like the 7 spokes of a regional startup hub. So if you're thinking of who to go out and recruit to participate in your innovation ecosystem, this is a good place to start and just check these boxes of do you have all the major corporations, both the traditional ones you would think of, so the healthcare related ones in this case, but also is there a role for an Airbus or another one who might have some interesting contribution to that ecosystem. Investors, local government, universities, academia, and then those, again, getting those startups and others involved. And this is actually more of a questionnaire or checklist you can walk through to help kind of do that assessment. One is, do you have the capital or have you mobilized adequate financial capital? Do you need to go out and secure it from other regions to pull in and support there? How can you take advantage of what's available locally as well as what do you need to grab from another area? Years ago, we did a report in the Midwest in Chicago, Illinois, and we noticed that we didn't have a problem attracting capital. We had a harder problem maintaining the existing capital that was in that region. So we analyzed a lot of the venture capital that was already in the region was investing on the West Coast or the East Coast, and that East Coast and West Coast investment was more active in the Midwest region. So we had a problem with just maintaining our own capital. So you have to kind of do that assessment. Are all those key actors in that community working with each other? Are they connected? What's the culture? Do they have the right mindset for innovation to work with each other? Do you need to host events and things like that, bring them together to create that energy? Density, is it concentrated enough to form that cohesive identity? Or is it so too spread out and ultimately it's going to make it difficult to connect and pull them together? And again, is there a specialization and do you have the talent to support that? And this last one, as far as the talent goes, tech talent to support the continued evolution and growth of digital companies is usually one of the #1 issues that holds back innovation ecosystems throughout many different regions in the US. They all put it on their roadmap as being a threat to the survivability of their ecosystem. So another way to think about it is an orchestra, right? And essentially you want to, after you've identified all your stakeholders, sure they can play great music on their own and it can sound beautiful, right? But how much more is it amplified and how much more does it sound better when they're working together, in a concert, right? And so this case, you could think of a woodwind family as being the corporations in your backyard. You can think of government as the percussion instruments. You could think of startups as the violin family. And when everybody's working together, everybody benefits the most from it. Right? Which brings me to Together Health. Together Health is, like I said, similar to the ECH Alliance in Europe in the sense that it's trying to connect all these regional innovation ecosystems that we just talked about on a national scale and understand what are the shared pain points that they have, because all of them are interested in supporting their own local innovation ecosystem. But if that's all they ever focus on, they're never going to be fully successful. If you want a startup to be successful coming out of, say, Paris, you need it to be able to connect to other markets as well. You need it to get connections to other customers, to other investors, and not just to be only reliant upon its local ecosystem. And a better way to facilitate that is by working with other ecosystem champions who have a vested interest in that bilateral relationship. So through Together Health, we brought together in 2017 over 30 cities throughout the US, the most neutral, connected, trusted local innovation ecosystem champion, if you will. So from Chicago, from Nashville, from New York, from San Francisco, from Madison, Wisconsin, from all over the country. And we asked them through a series of workshops of what would they be willing to work with each other on? What was it interesting? What were their shared pain points? Early on, many of them saw each other as competitors. They wanted to try to keep their startups in their own city, in their own ecosystem. They were worried they were going to flee to another one. But most of them were very open to the idea and understood that, and eventually started to realize there was more benefit in working together than there was from working apart. And this represents 12 accelerators, 6 incubators, 5 investors who play a role in really kind of growing their local regional innovation ecosystem. So for instance, HealthX Ventures out of Madison, Wisconsin isn't just a venture capitalist company. They also host a lot of events. They're a convener. They support bringing together the whole local ecosystem because it helps feed them with greater opportunities for investment, right? They believe in that. And in some regions, it's not an incubator at all. It's a health system. So like in Pittsburgh, it's UPMC and UPMC Enterprises, which really invests in their entire innovation ecosystem. They invest in things like robotics that aren't even in healthcare because they know they're going to bleed from the tech talent and the innovation that comes from that, and they're going to benefit from that in healthcare. So we pulled them all together and got them to working together on some shared areas. And it's this idea of working collaboratively, this power of community. We all have skin in the game, and where can we agree to work together? This is a map that represents most of the dots of who's coordinating through Together.health. There's a few that are missing because it's not up to date. We constantly have new states that are added. We have someone from Alaska and a few other states that you don't see with a dot on it. But the idea is that you have broad representation throughout the US, and they come together in person twice a year. Before the pandemic, they're starting to do that again. Earlier this year, they came together at the Vive conference, and then also at HIMSS. And then at the health conference, HLTH conference, they'll be coming back together again this fall. But they meet and they talk about what are the shared pain points of their startup communities, of their hospitals who are trying to work with startups, what are the problems that they're having, and that leads to projects ultimately. So these are the current projects that Together Health is working on. The first is the Together Health Security Assessment. This is all about the security risk assessment portion of a business associates agreement and trying to standardize that as much as possible so that way it's a repeatable, templated approach no matter what health system you're going to work with. This creates efficiencies for the startups, and it creates it also for the health systems. The Ecosystems Mapping Project is actually mapping out what are all the regional assets throughout the country and then connecting them on one searchable national map. So if you're going to go to Detroit, you can know that Techtown Detroit is a great place to go connect with ecosystems champions that are there. We also have a shared curriculum project, which is about every incubator and accelerator has curriculum they put their startups through, but they all develop it independently. They're now looking at sharing this. So Matter in Chicago, an incubator there, is sharing their curriculum with the Texas Medical Center down in Texas, and they'll do workshops for them virtually or sometimes even come present. And then last but not least is a focus on health equity by design and innovation. What can we do to push inclusiveness and equity focus for innovators and developers? And then with that, I will now wrap it up quickly, just by a quick commercial on the Global Digital Health Partnership. ONC took over. We helped launch this, but we took over as the chair this year. We have 18 months to be in charge of setting the agenda. The Global Digital Health Partnership represents 33 nations and then 3 international organizations, and is continuing to grow. France is a country that we're looking to actively get engaged in the Global Digital Health Partnership. They're not currently, and then also looking to partner in many other countries that haven't quite yet joined. These are the areas that they focus on and work on. They have several work streams. Usually one country will be the chair of that work stream, and another country will serve as the co-chair or backup for supporting that work, and then it's all shared open source. So just as it's important to collaborate on a local or regional or national level, we needed to collaborate on a global level, and we do this from government to government through the Global Digital Health Partnership. And then these are some of the work products. You can go to the website and click on these to see things like a white paper on responsible use of AI in health IT that was done between the UK, Canada, and the US, and several other resources. Something else that we've continued to work on through here on our interoperability stream is the International Patient Summary with HL7, or IPS, IPAS as we call it. And then again, this is a list of the current countries. If you're from one of these countries and you don't see your country on there, come talk to me. I can give you more information and hopefully get someone from your country to participate in this going forward. So with that, I'll close and hopefully have time for a few questions.
Thank you very much. From what I understood, your role is to make animation among all these communities or ecosystems, but do you also have a plan for financing some projects, some collaborative project nationwide? Because the US is a very big country, so I was wondering how all this could work at the national level.
Yeah, so currently the work that you saw through Together Health, I'm assuming that's what you're talking about, the collaboration for Together Health. So currently we don't fund that, but we provide convening support for it, and so helping to kind of be the catalyst to bring them all together initially, and hosting meetings and so on. There is some talk of potentially supporting the Together Health Security Assessment Project, as that's something that has been echoed by so many other leaders of that this is a problem. It's a business standard issue, right? This is a problem where any hospital in the US typically has their own security risk assessment tool. And if you're a startup, you're working with one hospital, you know, they say if you've worked with one hospital, you've worked with one hospital. That's it. And then the second one is a completely different experience, completely different questions, and it can take 9 months, 12 months, sometimes 18 months to go through that process. And of course, as you can understand, that would stifle quite a bit of innovation. It also leads a lot of bad taste in the hospital's mouth. So you may have an innovation team at a hospital who's wanting to work with startups, but they have to sell that to the rest of the C-suite, to the CIO and to others, and say, let's work with this startup. And if a project they get excited about and greenlit takes 12 to 18 months before it can even start, then that's a problem. But we do find sometimes a couple of accelerators to help bring these communities together around a certain issue. So for instance, we did the Pandemic X Accelerator to try to drive more innovation into the pandemic, both dealing with the current one as well as developing solutions in a number of areas for mitigating future pandemics. We did one around Kidney X, a national accelerator where we put some money in and we commingled that with private sector funding. It was a total of around 25 million or so to fund innovation around kidney care, improving and innovating in the dialysis process because it's such a high spend for the US federal government through our CMS. And there's a couple of other, we did around Lyme disease and a couple of other areas. And then for more technical interoperability pilots, we have an ongoing grant program that we do, the Leading Edge Acceleration Projects, or LEAP grants, where we fund some, but it's small scale. It's, you know, 5 pilots maybe nationally, and usually they have to apply with some kind of collaborative group locally, a health system, a startup, whoever else it might be, a regional health information exchange. But then it's hard to see those things scale, so we're trying to figure out how can we fund something like that to prove it's possible, but then provide it with follow-on support to then help it scale nationally, to where it's not just in 5 hospitals, but it's in, you know, hundreds.
So maybe you could take France as a pilot, since France developed a digital roadmap to have interoperability in the whole country, which is currently ongoing, and see if it can be made in the US, which is much bigger than France. And we all know that it's very difficult in France already to have everybody aligned, hospitals and industrials. So, but it could be interesting for you to meet the national direction DNS. Okay,
yeah,
good.
It's on the plans. We want them to join global. No, we've had an interoperability roadmap for years. We've updated it several times. The current one, we just actually put out an open call for not us to develop a strategy and a roadmap and put it out to the public and say this is our vision, but rather it was called Health Interoperability Outcomes 2030, and it was as we are updating our next roadmap, we are asking the public for input. So it's an open call for, you know, a request for information about what are the outcomes that people would like to see. So in 2030, you can see what happening. It's, you know, and it was open-ended, so anybody could reply with something like, you know, it's easy for me to download an app and say, I want all my health information across every place that it exists, whether it's you know, a corner retail store, or my physician, or my behavioral health specialist, or a community clinic that I went to, or you know, whatever it might be. I can download an app, push a button, and all of it shows up in 1 minute, right? Just like it can with financial information, right? Like that's some of the things where we're asking people, like, what are the outcomes you want to see? And it was a wide range of responses we got, and all that's available on our website as well. We summarized some of the key points that came out of that.
Okay, many thanks, Stephen. Are there any more questions?
Thank you for the presentation. In all of the presentation, you didn't actually speak anything about the relationship with the FDA.
So I did. It just was very subtle. So the FDA we work very, very closely with. Our agency is very small. We're only 180 employees, give or take. So as a U.S. federal agency, that is very, very small. But we're all subject matter heavy, and we coordinate across all the other agencies. They're the big ones. So FDA, thousands of employees, CMS, thousands, et cetera, CDC, so on. We sit in the office of the Secretary of HHS and coordinate across all of them. We manage the Federal Health IT Coordinating Council. The FDA is part of that. So they are one of the 20 agencies under the HHS and the other 20 agencies that are not under HHS that participate in that coordinating council. And we set that agenda. We work with them all to look at things like, for instance, most recently, we're working with them very closely on responsible use of AI in health IT. So they do a lot of coverage and work around clinical decision support tools, but not administrative transactions. So if you have an AI solution for scheduling, and I've mentioned this to a few people recently, that's not covered by FDA, right? Because it doesn't have a clinical outcome effect, right? But it can have an access to care impact, right? As far as if you have a scheduling tool that's canceling appointments based on a certain demographic, you know, analysis that feeds it, that could have, you know, issues for equity in access to care. So who's overseeing that? And that's our job, is to look for those gaps, determine is that something that we need to fill? Is there a role with our certification program to address that? Or do we need to identify another agency to take the reins on that and advise Congress to give that agency the authority, or expand the authority of FDA? We also work with them on digital therapeutics. They're going to look at the clinical efficacy of it. We're going to look at the technical standards that are necessary to support the adoption and integration of those things. So we work very closely with them and all the other agencies as well. So, thank you. Merci.